Welcome to the Cosmetic Clinic channel. So today we are here to discuss something very critical regarding one of the most commonly performed surgeries in Cosmetic Clinic. That is a rhinoplasty surgery. So as you all know, rhinoplasty surgery is a nose job in which we do cosmetic changes to the nose for cosmetic improvement and functional improvement. So one of the most commonly asked question when it comes to rhinoplasty is, Doctor, what is the cost of rhinoplasty? Because the cost of rhinoplasty is quite variable. It depends. It varies between different centers, between different surgeons, and depending on the complexity of the surgery and what particular procedure suits that patient. Each client is a separate person, and what they require is kind of completely different from another person who require for their nose. So in my first consultation, it will be most of the times an informative session in which we'll discuss with the client regarding what they need, what is their expectation about their nose, how they want it to be changed. Then I'll tell to them specifically what I can do, and we'll go in for a simulation. It's with a software called Chrysalix. It's a 3D reconstruction software in which we can make those changes on that client's nose and show them this is what is going to happen to your nose after the surgery. So after that, sometimes they tell me, like, Doctor, I don't want much change on the dorsum. That is, I don't want the dorsum of the nose to be curvy. I don't want a concave dorsum. I want it to be flat. Sometimes male patients, they tell me, like, Doctor, I prefer a little bit of a small hump on the nose rather than removing it. So I don't want that hump to be removed. Some patients will come to me and tell, like, Doctor, I want a little bit projected tip. I want a concave dorsum. So depending on that, it's very easy to tell this particular change I want. But sometimes that small change makes the surgery fully different. So rhinoplasty, when we consider the complexity of the surgery, it can range from a very small tipplasty. Tipplasty is a kind of procedure in which we do the work only on the tip. We don't touch the bone, we don't touch the inside cartilage, we don't touch the septum. Instead, we go in, we open the nose. It can be an open or closed rhinoplasty when we deal with the tip. So either by an open method or a closed method, we reach the tip, then we reshape the tip, then we readjust according to what kind of tip the client wants, and finally we may thin the skin a little bit, or if the patient already have not a very thick skin, we'll avoid thinning the skin. So this is a procedure which is done for a tipplasty, and tipplasty many times we can do under just local anesthesia without going in for a general anesthesia. So all these things, the duration of the surgery is less, the anesthesia for the surgery is local anesthesia, and the time consumed by the surgeon inside OT is quite less, and we don't have much consumables because we don't use a piezo for cutting the bone, we don't use splints, we don't use sometimes we avoid using extra nasal packing also. So you can imagine all those things, the requirement of skill, the time duration, the requirement of consumables, all those things are less, and the client will get discharged early. They don't have to visit me the next day. The visits will be, so those kind of surgeries are always a little less expensive. So the charges for a tipplasty usually varies around 60,000 to 80,000 in our Cosmetic Clinic. So when you consider going to the next level, like the most commonly performed surgery in all types of rhinoplasties is a primary rhinoplasty. Primary rhinoplasty, when we say in our place, a primary rhinoplasty usually involves a septal work, a tip work, and most of the times our threshold for doing an osteotomy is quite less, because osteotomy makes a real good change on the profile of most of the noses. But in specific cases who have a narrow mid-vault, or the middle part of the nose is already narrow, and only the tip work need to be done, then we don't consider. Otherwise, most of the primary rhinoplasties, we usually consider osteotomies. And when you do osteotomy, we do it with a piezo. Piezo is a specialized cutting device for the bone, for the precision cuts, and it creates very less swelling and very less bruise, and the recoveries are very fast. The swelling post surgery is quite less, so that you can resume your work at the earliest. And I know nowadays it's not a major problem because of the mask. You may get a little extra time for the swelling to have, but still, like, it's a matter of your confidence. So that definitely helps you in having the edema subsiding quite fast. So in a primary rhinoplasty, the cost of the rhinoplasty can vary, and it's most of the times it is done under IV sedation or a general anesthesia. Generally, we prefer general anesthesia in Cosmetic Clinic for the rhinoplasties, because mainly the tube protects your airways, and since it is a surgery which is done inside the nose, sometimes like maybe a little bit of bleeding can occur. It will be usually 100% it will be controllable, but still, sometimes when the bleeding occurs, like when the tube is there underneath, we get an extra protection. So for the safety of the patient and for the convenience of the surgeon, every time a GA is preferred to any other anesthesia technique in a rhinoplasty when you consider a primary rhinoplasty. So the cost of a primary rhinoplasty, when we are doing like the proper tip work, tip skin thinning, and osteotomy, and the septal work, the cartilage work, and all those things, it usually we finish a primary rhinoplasty in 2 hours time. 1.5 to 2 hours is our usual time for a primary rhinoplasty. And the cost of the rhinoplasty varies according to which all things we combine. If no more add-on procedures are there, it can range up to 1.4 lakhs, and sometimes it can go up to 1.6 lakhs depending on the complexity of the surgery. And when we come to the most difficult part of the rhinoplasty, that is always a redo rhinoplasty or a secondary rhinoplasty. So when we consider the most complex rhinoplasty, it is always a secondary rhinoplasty. Secondary rhinoplasty is a redo rhinoplasty in which the client has already undergone a procedure with some surgeon, maybe the same center or some other center. Then the problem of a secondary rhinoplasty is already the planes are open and some changes are already happened in the nose. And sometimes when the client comes with a proper discharge advice, it is actually much easier for the next surgeon to understand what is already done on the nose and what is to be done. And sometimes the worst thing is actually many of the clients, they come with just a discharge advice saying rhinoplasty done. So that is quite difficult for the second surgeon to operate on that patient, because like from examining from outside, we won't come to know at all, even though we have some idea what would have done, but the previous surgeon would have done something else in a different way. Then actually it becomes a total surprise during surgery. It cannot be detected by a scan, cannot be detected by an X-ray what is being done. So when if the client comes with a proper discharge advice saying what all are done, then actually we will have a more clear plan, like whether most of the times we consume the septum during when we do the primary rhinoplasty. Then if it is a structural work, for doing that work, I need something extra to be brought to the nose to give the structure a little bit more support. Then most of the cases in a secondary rhinoplasty, we end up taking a rib cartilage or a ear cartilage. And we are slightly more inclined towards the rib cartilage than the ear cartilage, because the quality of the cartilage is quite good, and the related complications and the healing of the scar, everything is much better with the rib cartilage than the ear. But even then, sometimes clients are worried about having a small scar on the chest. Then we go for the ear cartilage. So these procedures, they take a little more time. We need an extra time to take that cartilage from the other place, then to bring it to the nose, and the dissection, the surgery time, everything will be much more. So in a secondary rhinoplasty, if the doctor have an idea like what is being done before, then it will be slightly easier than the one without a proper discharge advice. So then the cost will be slightly more than the primary rhinoplasty. It can vary from that 1.4 to 1.7 or 1.8, somewhere like that. When it is more complex or a very difficult surgery. So what you should understand is, when you consider a rhinoplasty surgery, the cost can be anywhere between the 60,000 to 1.6 to 1.8, varying on the complexity of the surgery. So when you are considering a rhinoplasty, how you should select the surgeon or the center? See, just like any other surgical procedure, much more than any other cosmetic procedure, the best time to do a rhinoplasty, or the best possible way to give the best result in a rhinoplasty, is when it is done the first time. So make sure when you consider a rhinoplasty, you get it done from a proper place where the surgeon shows their proper results before after of a similar patient who have undergone a similar procedure before, and make sure the surgeon is a plastic surgeon who is a qualified and trained plastic surgeon who is well versed in doing rhinoplasties, and that is your best chance for getting the best results at the best cost. So just imagine you are getting a tip-plasty from a place or a surgeon who is inexperienced, and you are going for a secondary rhinoplasty. You will be spending much more for a second surgery, and you will be getting a much more compromised result than you're getting a primary rhinoplasty done at the right time, at the right place. So always compare cost and effectiveness. When you go to a shop and buy something, you should always make sure that whatever you buy with that money is cost effective, and that you can use for some time, and that has the worth of that money. So make sure whenever you select your surgeon, whenever you select your surgery, be wise, select the right choice, and make sure 3-4 times with other clients, with the reviews, by seeing their results, visiting their website, talking to them in a virtual consultation, come and meet them, see your simulation, make sure the process is going right, and then the things will go in a right way, and you can get it done in the proper way. So thanks a lot. Thanks for watching. If you have any doubt regarding the cost of rhinoplasty or anything regarding rhinoplasty, you can ask us in the comment box below, and we'll be continuing with the same series of more educative videos in cosmetic surgery, and especially rhinoplasty, because you know that our most favorite region is facial plastic surgery, and out of that the most famous, out of that the favorite one is rhinoplasty. So we'll be continuing with the similar topic in the same series. So please subscribe and follow our channel, and you can ask any doubt in the box below, or you can contact us directly in the number provided. Thank you. Thanks for watching.